Bismillahirrahmanirrahim. Quote of the day: Be patient, for what was written for you was written by the greatest of writers. Today I will present one of my topic, communicable diseases, and in which there is a smallpox is presenting topic under kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is introduction, mode of transmission, level of prevention, efforts towards eradication, updates, and at the end, there is an MCQ session. In the end of this presentation, participants will be able to describe about smallpox infection and efforts towards the eradication of this disease throughout the world. Basically, smallpox is a double-stranded DNA orthopox virus, variola, cowpox, vaccinia, and monkeypox. There are many forms of there are two forms of this virus, variola major or minor, and it is stable outside the host and retains its infectivity. And the last case of this disease is reported in 1977, and this smallpox is eradicated throughout the world. There are many modes of transmission of this disease, like person to person, with the inhalation of droplets, by direct contact with infected body fluids, scabs, contaminated objects, by beading clothing and bandages, and aerosol. The aerosol is a rarely mode of transmission, and it is spread more easily in cool, dry winter months, can be transmitted in any climate, and there are no transmission by insects or animals. Transmission of a smallpox in prodrome phase is less common, and in the prodrome phase there is fever but there is no rash, and the most contagious is phase when the rash is appeared and their first 7 to 10 days, and it is contagious until the last scabs falls off. Incubation period is 7 to 17 days, and it ranges from 12 to 14 days, and the initial sign is small red spots in mouth and on tongue, and then there is a rash on face which is spreads to arm, leg, hands, feet, and it is in the centrifugal distribution and throughout the body within 24 hours. And there are two forms, variola major and variola minor. Variola major is a most common and severe form. Extensive rash is present throughout the body, high-grade fever, and the rash may be ordinary in discrete, confluent, and semi-confluent form. Modified, it may be flat or hemorrhagic, early or maybe late. And then comes the variola minor. This is less common and less severe form of disease. This is variola major, and the rash is discrete type in which pustules separates and not merging with one another. Most common form of smallpox is discrete form. Then this is the semi-confluent and confluent. Pustules begins to merge, and in the confluent form, pustules joining and becoming confluent. And this is the hemorrhagic form, less than 3% of all cases, and two types of hemorrhagic form, early and maybe late, and death occur before pox lesions appear. It is the fatal form of variola major. This is variola minor, form of rash. In variola major, ordinary cases 20 to 40% case fatality rate, and in the flat and hemorrhagic case, usually fatal, and the blindness and limb deformities. And variola minor is less than 1% case fatality rate. Recovered cases, when the cases are recovered, then there is a lifelong immunity is developed from this disease. Pre-eruption phase, Then comes the papules and vesicle. Then there is the appearance of pustules and then formation of scabs, and then the scabs are fall off. So the incubation period of whole disease is 4 to almost 21 days. Differentiating between smallpox and chickenpox. In the smallpox, 2 to 4 days before the rash, there is a fever, and chickenpox at the time of rash. And the rash appearance, pox at same stage, pox in several stages. And its development in smallpox, there is a slow development, and in chickenpox, there is rapid development. Distribution, more pox on the arms and legs, and more pox on the body. On palms and soles, in smallpox, they is usually present, and in chickenpox, it is almost absent in palms and soles. Deaths occur more than 10% of cases, and in chickenpox, there is very uncommon. Level of prevention, how we can prevent the disease by the help of health promotion, educate the people, wearing masks, isolation of positive cases, and habitat of cleanliness. Then comes the variolation. Variolation is the process by which material from smallpox source was given to people who had never had smallpox. This was done either by scratching the material into the arm or inhaling it through the nose. With both type of variolation, people usually went on to develop the symptoms associated with smallpox, such as fever and rash. The basis for vaccination began in 1796 when an English doctor named Edward Jenner observed that milkmaids who had gotten cowpox did not show any symptoms of smallpox after variolation. The first experiment to test this theory involved milkmaids Sarah Neves and James Phillips. And how the vaccination is occurring. In the vaccination, there is a live vaccine virus administered using bifurcate needle, not an injection. Dip into vaccine and then pick the skin 15 times in about 3 seconds in 5 mm radius, and administered a superficial layer of skin given on right side universally. This is the primary vaccination site reaction when we did the variolation. And for the control of this disease, there is also US outbreak control strategy in which ring vaccination technique is used. And in the ring vaccination technique, we can identify a case, then we contact to the cases, and then we contact to a contact. So we can work in a ring manner for the control and spread of this disease in US during the outbreak era. Contraindication for vaccination: eczema or atopic dermatitis, skin condition like chickenpox, herpes, psoriasis, or shingle, weakened immune system. If you have transplant, chemotherapy, HIV, and some others uh, diseases in pregnant women less than 18 years, breastfeeding mothers, and if exposed, get vaccine no matter what. And in the secondary level of prevention, you can early detect the cases by traditional confirmatory method, electron microscopy of vesical fluid, culture on chick membrane or cell culture, and availability only at reference lab, new rapid test, PCR, and in the evaluation criteria, the CDC proposed evaluation criteria for clinicians to rule out patient with rash, major criteria and minor criteria. In major criteria, febrile prodrome phase, classic lesion appearance, and in the minor criteria, centrifugal distribution, slow rash evolution, and toxic appearance. And in if you diagnose a case, then prompt treatment, and there is no specific treatment, only you can supportive medical care, isolate person until all scabs have fallen off. It's time for the updates. WHO smallpox eradication campaign begins in 1967 and almost it continues in 1975 throughout the world. And October 26, 1977, last case of smallpox reported, and in May 8, 1980, official declaration by WHO successfully declared smallpox eradication. Last case of variola minor in Somalia, 1977, and last case of variola major in Bangladesh, 1975. Why this disease? What are the efforts which are given towards the eradication? In 1959, the WHO indicated a plan to get rid the world of smallpox. The intensified eradication program began in 1967 and laboratories produced more higher quality freeze-dried vaccine, production of bifurcate needles and star surveillance system, and the mass vaccination campaign is began. Why the eradication becomes successful? Because vaccine available, there is no animal reservoir, vaccinated person easily identified, and disease easily identifiable. Why it is known as bioweapon potential? Because it is prior attempt to use as a bioweapon in French and Indian War 1754 to 1767. British gave Native Americans the infected blankets, and allegation of use in US Civil War, alleged use by Japanese in China World War II. So that's why this is also known as bioweapon potential. It can be produced in large quantities, stable for storage and transportation, produce stable aerosol, high mortality rate, person to person spread, and most of the world has little or no immunity. In research purpose, the goal of smallpox research is to address three areas that are essential for public health: finding better antiviral drugs to treat smallpox, making safer vaccine, including tests to detect variola virus. All research using variola virus is overseen by WHO. The WHO Advisory Committee on Variola Virus Research reviews the research that is proposed each year. There are two design sites where stock of variola virus are stored and used for research. One is Center of Disease and Prevention, Atlanta, Georgia, and the Russia State Center for Research on Virology and Biotechnology in Russian Federation. Now it's time for the MCQ. Smallpox has a viral disease and it spread through close contact with infected material. When smallpox is most infectious, one source develop in mouth, one source develop in throat, once rash develops, increase in body temperature, and once scabs fall off. The answer is C, once rash develop. Smallpox is completely eradicated and there are no cases of smallpox anywhere in the world. Which number of cases should be considered for outbreak? 1 case, 10 cases, 100 cases, 1000 cases, or 10,000 cases? C. A is the right answer, 1 case. Smallpox was very contagious disease, which symptoms initially report by patient in OPD settings: rash, fever, headache, body aches, vomiting, diarrhea.
A.
B, fever. There are multiple stages of sign and symptoms of smallpox. Which trace of smallpox often remains after the infection ends? Chronic fatigue, poke marks on the face, blindness, sensitivity to sun, allergic rhinitis.
B.
Yes, B is the right answer. Poke marks on the face. Initially, variolation was done for treating the patient of smallpox, and then vaccination was started for treating the patient. Which type of needle is used for vaccine the patient? By 5 cc injection, by single needle, by two-pronged needle, by 10 cc injection, by 20 cc injection.
B.
No, C is the right answer, by two-pronged needle. Eradication of smallpox was a big challenge for WHO at that time. Target has been achieved due to which following epidemiological facts: highly effective vaccine, no long-term carriers, easy case detection due to rash, elimination of animal reservoir, effective surveillance system.
B.
D is the right answer, elimination of animal reservoir. Working on the synthesis of vaccines started after 1780. The vaccine used to eradicate smallpox originated as live smallpox, live cowpox, genetic recombinant, killed whole virus, frozen vaccine.
A.
No, its answer is B, live cowpox. There are various type of variola major. Which type of variola major have case fatality rate more than 95%? Ordinary type, modified type, malignant type, hemorrhagic type, or discrete type?
D.
Yes, D is the right answer. Multiple outbreak reported throughout the world before its eradication. There was multiple preventive strategies used for the control. What was the name US outbreak control strategy? Ring vaccination, variolation, active surveillance, passive surveillance, mass vaccination.
A.
A.
Yes, A is the right answer, ring vaccination. Before the development of vaccine, the technique which was used for the control of outbreak, variolation, inoculation, immunization, induration, or piercing.
A.
A is the right answer, variolation. This is the key of my MCQs. YouTube link of this presentation. Please like and subscribe over YouTube channel for the presentations. And thank you.
Thank you very much, Dr. Naila. Very good presentation, especially the recent advances, and the MCQ part was good. And your concept about the ring vaccination, variolation, vaccination is so clear that I hope everyone get a lot of benefit after this presentation. So thank you very much once again, and see you in department today. Allah Hafiz.
Thank you, ma'am.
Allah Hafiz.